You may have some friends or relatives who are presently hospitalized or getting breakthrough infections in spite of 2 doses of COVID-19 vaccine. And so you're wondering whether you need a booster shot. So do we need booster shots? Let's watch this. So if you like my video, please click like, subscribe, and click on the notification bell so that you'll be notified for any new uploads to come. So we are hearing about more and more of our friends and relatives who have sought out supplementary COVID-19 vaccines even after they have completed 2 doses of their COVID-19 vaccination. People are really worried about breakthrough infections among the vaccinated, when in fact, in reality, if you look at data, the risk of getting COVID-19 infection among those who are fully vaccinated is extremely small. If you look closely, recently our Department of Health and the FDA provided us data among fully vaccinated Filipinos and noted that the rate of getting infection is significantly very small. In fact, in this FDA data, out of the 11.7 million fully vaccinated individuals, only 735 got breakthrough infections. These are cases that were detected more than 14 days after the second dose. Of note, of these 116 breakthrough infections, majority or around 88 to 90% are mild and asymptomatic, and only less than 11% were hospitalized, with only 1% reported dead. So these breakthrough infections of FDA compose therefore only a very minuscule 0.0013% of the total 9.1 million fully vaccinated individuals as of August 1, 2021. You can clearly see here, therefore, based on our own local setting data, that breakthrough infections can still occur, but in a very small percentage of fully vaccinated individuals. But of note, they are mild or asymptomatic, and definitely the vaccines worked in protecting individuals against getting severe COVID-19 infection. We have to remember that vaccines do not offer complete protection against infection, but at least data have shown that locally, the vaccines that have been given to Filipinos have shown to prevent severe cases and deaths among the vaccinated. So if you look at our data, the record is clear that for over 5 million, for example, fully vaccinated individuals with Sinovac, there were only 91 breakthrough infections that were noted, including one death. So what does this mean? That the rate of getting COVID-19 infection after a complete dose of Sinovac is only 0.002%. On the other hand, for the 900,000 Filipinos who got the AstraZeneca vaccine, only 24 breakthrough infections were noted with no deaths, meaning a very small percentage of breakthrough infections occurred among individuals who were fully vaccinated with AstraZeneca, only 0.003%. We cannot yet determine the Pfizer and the Moderna and the Johnson vaccines because they were pretty small in numbers who were inoculated. So in general, our local data do really look good. In other words, our vaccines are all working in protecting us. If there's one thing about booster shots that we don't have any controversy, is that we are all in agreement that those individuals who are immunocompromised and those particular populations, like those suffering from HIV or diagnosed with cancer who are on immunosuppressive drugs, should get a booster shot. Recent data on immunocompromised patients who were given booster doses, and those immunocompromised individuals, the extra booster dose which was administered at least around 2 months after the second dose, was well tolerated and mostly had only mild side effects. And what is important, the booster shot prompted substantial improvement in patients' T cell responses, which is another aspect of the immunity. But the general question is for the rest of us, do we really need boosters? So far, there are ongoing 54 studies on COVID-19 vaccine booster shots, and it is therefore best that we await the results of this study before getting one yourself. For now, data worldwide is consistent that people who are vaccinated are not the ones who are sick and hospitalized with the Delta variant, but people worldwide are sick because they don't have the vaccine. So we don't, so far at present, need another third dose yet. Meaning, it's too early for us to clamor for one. If we are immunocompetent, our immune system has those memory cells that can mount antibodies anytime our body is again exposed to the COVID-19 virus. And therefore, the experts believe that at present, there's really no need for us to rush out in getting out another booster shot. We, however, do have preliminary data regarding boosters that are slowly coming in. Whether we are giving boosters of the same brand, like in Turkey, where those patients who were given 2 doses of Sinovac were given another Sinovac booster shot, or mix and match, all are working together in increasing antibodies. In this Turkish study of 30 million vaccinated citizens, you know what they found out? That the highest level of protection in terms of antibody level were noted in those who received 3 doses of the same brand Sinovac rather than 2 doses of Sinovac as first and second and giving a third booster of mRNA, meaning 3 doses of the same brand based on this Turkish study will give you more antibody production as a boost. On the other hand, we also have preliminary data on mixing and matching COVID vaccines. There are now several studies showing the benefits of mixing and matching vaccines, and so far, they've been proven to be safe with no adverse events. However, all these studies are pretty small to pick up adverse effects that occur rarely. And therefore, we need to await the results of these larger studies before we can safely say that indeed booster shots are safe. So, what's my take on booster shots? An annual COVID-19 booster shot is not likely because COVID-19 is a very different infection caused by a different virus. You cannot compare it with flu. The flu has a rapid mutation and therefore it changes year to year. So although the virus that causes COVID-19 has developed some mutations along its spike protein, it's not like flu virus when we have to adapt to the strain for the year so that we can develop a flu vaccine for that year. So the changes so far we have seen with COVID-19 are due to the fact that a lot of our patient population are still unvaccinated. So the more unvaccinated patients, the more likely that they get infected and there will be more mutations. So maybe there will be a variant-specific booster that we need to give every year. We don't know. However, as long as there's no significant variation or variants that will come, I don't see why anyone with a healthy immune response or who are immunocompetent to respond to a vaccine would need a booster in the next 2, 3, or 4 years down the line. As Dr. Monica Ganti has said, who is a renowned infectious disease specialist, she is more optimistic. For her, if people who are immunocompetent are going to need boosters at all, it is very unclear, as long as they have been fully vaccinated. Why? Because all of the vaccines induce good immune response, which again includes not just antibodies, but also T cells and the memory B cells. She cited a 2008 study that showed that people who have been infected by influenza as kids way back in around 1918 still continued to develop memory B cell immunity 90 years later. So clearly, these memory B cells can last for several decades. But she said that on the safe side, and because the novel coronavirus is still so new, she thinks it makes sense probably that we will need boosters at least once in a decade. Definitely not yearly, and definitely not soon. So, for those of us who are clamoring for booster shots just because we can afford it, this clamor and need to get a booster shot will only distract our government from the need to provide first and second dose to some of us who haven't been vaccinated. For me, using the limited supply that we have as booster shots, even though we can afford to get one, will only deprive some areas of our general population, of our kababayans, the right to get their first and second dose. So, with that, I hope this clears the issue whether we need booster shots or not. I'm Dr. Jerry Tan. See you again soon.